5 OTC medications doctors use carefully. These are common drugs that require caution and professional guidance. Most of us grab over-the-counter medicine without thinking twice. If it's sold without a prescription, it must be completely safe, right? Well, mostly yes, but not always. Even common painkillers and cold medicines can carry risks when used too often. Today, we're breaking down 5 everyday medications doctors personally use with extra caution and why you might too. Over-the-counter drugs are tested and approved, but available doesn't mean risk-free, especially for older adults or long-term users. Medical organizations regularly warn that some common medications may increase bleeding, confusion, organ strain, or fall risk. Doctors often follow one simple rule: use the lowest effective dose for the shortest time possible. First up, NSAIDs, medications like ibuprofen and naproxen, popular for headaches, arthritis, and muscle pain. They reduce inflammation really well, which makes them powerful, but that power comes with trade-offs. Frequent or high doses can irritate your stomach lining and increase the risk of ulcers or internal bleeding. NSAIDs can also strain the kidneys, particularly if you're dehydrated or already have kidney concerns. To use them safely, take with food, stay hydrated, and avoid alcohol whenever possible. And avoid using them continuously for more than 10 days without checking with your healthcare provider. Next is acetaminophen, often seen as the gentler pain reliever because it doesn't irritate the stomach. But here's the hidden risk. Taking too much can seriously stress the liver. The tricky part? Acetaminophen hides inside many cold, flu, and sleep medications. Exceeding about 3,000 to 4,000 milligrams a day can increase the risk of liver damage. It's important to stay within safe limits. Doctors recommend reading every label carefully and tracking total intake from all sources. If you drink alcohol regularly, combining it with acetaminophen increases liver strain even more. Third on the list, diphenhydramine, commonly used for allergies and sometimes as a sleep aid. It works well, but it can cause drowsiness, dry mouth, constipation, and urinary problems. In older adults, it may increase confusion and raise the risk of falls. So it's crucial to monitor these side effects closely. That's why many doctors prefer newer, non-sedating allergy medications for daily use. Occasional use is usually fine, but nightly sleep support may not be ideal long-term. Now let's talk about aspirin, especially low-dose versions often taken for heart health. Aspirin thins the blood, which can help in some cases but increases bleeding risk. That includes stomach bleeding or even bleeding in the brain, particularly with age. Doctors now individualize aspirin recommendations instead of suggesting it routinely for everyone. Never start daily aspirin without speaking to your healthcare provider first. It's important to get personalized medical advice. Finally, proton pump inhibitors like omeprazole used for heartburn and acid reflux. They're highly effective, especially for short-term symptom relief. They provide quick and noticeable improvements. But long-term daily use has been linked in some studies to nutrient absorption issues. There are also possible concerns about bone health and infection risk. We should discuss these potential issues in more detail. Doctors often recommend lifestyle changes first, like smaller meals and avoiding trigger foods. If symptoms persist beyond 8 weeks, it's worth reevaluating with a professional. These medications aren't bad. They're incredibly helpful when used properly. The key is thoughtful use. Lowest effective dose, shortest necessary duration. Read labels carefully, avoid doubling up on ingredients, and track what you're taking. If you're over 60 or taking multiple medications, consider a medication review. Your pharmacist can help ensure everything is safe and effective. Subscribe MAFROOT's YouTube channel for more details. Sometimes the smartest health decision isn't adding something new. It's using what you already have more wisely.